Assisted reproductive technology. ART is a group of special techniques that help in reproductive in infertile couples by retrieving oocyte from the ovary or sperm from testes, bringing about artificial insemination, development of embryo. The different procedure of ART are each an artificial inseminated brought about by husband semen. The latter is was centrifugated and undergoes swim to concentrate only motile spermatozoa. About 0.3 ml of semen having at least 1 million sperm is required. The semen from the human is artificially introduced to vagina or into uterus. Intrauterine insemination or IUI. AID. Artificial insemination donor is required when the husband from a defective semen bank is operated by all artificial insemination center. Here some of the different attorney groups with all types of blood grouping and RH typing are kept in progenitor surrogate mother. In case the wife is unable to bear the child due to defective uterus, a surrogate mother can be hired if available for bearing the child developed through IVF or ET. IVF, ET test tube baby. IVF in vitro fertilization, the key of fertilization carried out in a glass container outside the body of the mother. It is embryo transport or implantation of very young embryo into the uterus of the mother. IoT or intrauterine transport, the technique was developed by Patrick Steptoe or Robert Edward of UK in 1970. First successful trials of the technique were carried out in India by Indira Hinduja 1986 in Mumbai and Badanath Chakravarti 1986 in Kolkata. The various steps of F and ET are as follows. Induction of superovulation. Drugs are administered to prospective mother for induction of superovulation, the development of several ova. Different drugs are used by different workers. Clomiphene citrate plus human menopausal gonadotropin, clomiphene citrate for pure FSH, HMG, RH analog for us, HMG or FSH. The drug causes a number of oocytes to grow simultaneously into Graafian follicle, monitoring follicular growth. Follicle is observed by the sonography. Serum ostradiol estimation is made when follicle size reaches more than 18 millimeter diameter. Serum ostradiol level more than 250 pg per ml per follicle. 5,000 to 10,000 IU/SCG is injected intramuscularly. The latter is not given if ostradiol level is more than 2,500 pg per ml per follicle. Oocyte retrieval nearly 36 hours after SCG administration and just before actual ovulation. The mature oocyte retrieve. It is carried out by either abdominal laparoscopy or through vaginal route. Under sonographic guided sedation is required. Maintenance of eggs. The retrieved mature oocytes are placed in culture containing nutrients. They are examined to separate the mature oocyte from the immature ones. The culture having required oocyte is kept in an incubator for 4 to 6 hours. Semen has to be used for insemination is prepared concentration of wash and swim up technique only 50,000 to 29,000 and fully functional sperm are required. Fertilizer purified sperm is found over mature retrieved oocyte examined 12 to 24 hours after insemination. The fertilized eggs show no two pronuclei and second polar body of fertilization occurs outside the female body of a culture mediated is in vitro fertilization. Sperm count is very low. A single healthy person can be injected over. It is called intracytoplasmic injection. Separation of fertilized egg. The fertilized eggs are allowed to remain in culture medium maintained in incubated for 48 to 72 hours. During the period of fertilized egg undergo cleavage and reach 4 to 8 cell distribution transfer 2 to 3 fertilized 4 eggs over are picked up in a fine flexible tube. They are passed into fallopian tube or zygote. Intrafallopian transfer are placed close to fundus in the uterine cavity through the cervix. IoT or intrauterine transport. Excess fertilized oocytes are cryopreserved for use in case of implantation failure. Luteal phase support. Progesterone is provided to the would-be mother for the next 14 days in case of dose of 100 mg microionized thrice a day or 50 mg oil injection intramuscularly once a day. Testing of pregnancy of the 14-day pregnancy is selected by SCG test. The success rate of pregnancy is 25 to 35%. Take-home baby rate is 5 to 20%. As the fetus becomes mature, the baby is delivered through K. Tobol Eniris Gift into gamete intrafallopian transport. It was developed by Ask at al in 1984. In this process, two of the retrieved unfertilized oocytes and 25 lakh motile sperm pass into the phyllomen through laparoscope fertilization occur in vivo. Zygote intrafallopian transport techniques was developed by Deproye et al. 1981. Day old in vitro fertilized zygote with up to 8 blastomeres introduced fallopian through either laparoscope upper abdomen or uterine ostium under ultrasonic guidance. Intrauterine transport early embryos more than 8 blastomeres formed from in vitro fertilized egg directly transferred to uterus for further development. Embryo transfer. It is transfer of embryo of an other couple from in vitro fertilization into womb of a female who cannot conceive. Infertility treatment is specialized professional excessive instrument and chemical which are found only in a few. So this specialization can be applied by selected people only.